Let's do AM News now. Now, a 32-year-old kidney patient is asking for help to pay her medical bills. Oneida Salam was supposed to be discharged more than a month ago after undergoing treatment at the Upper West Regional Hospital. Now, correspondent Rafi Salam, who visited her at the dialysis center, reports that she owes in excess of 10,000 Ghana cedis, and she's calling on government and benevolent organizations to help offset the bills.
In charge of the dialysis center of the Upper West Regional Hospital, Kurusa Daniel removed the veil on the myths surrounding dialysis.
Especially within our community here, people think like when you are having kidney problem and you are supposed to do dialysis, it's a death warrant, but it is not so. So we are doing our best to actually demystify that perception that the public hold.
The dialysis center of the Upper West Regional Hospital was established in November 2022 and has since attended to by dozens of patients. One of them is 32-year-old Ubeide Salam. She cannot exactly state when she had a kidney disease that requires dialysis, except to list the symptoms that force her to come to the hospital for a medical examination.
I had swollen legs, bloated stomach, puffy face, and high blood pressure. I have never been to the hospital without the doctors telling me I have high BP.
The mother of 3 every week comes to the dialysis center twice for treatment. She is required to pay at least 450 Ghana cedis for each session, an amount that she struggles to pay, considering the petty business that she is in, selling soft drinks and sachet water, carrying them overhead. Her husband is a master craftsman, but barely hard work that can take care of the family, let alone paying for dialysis.
It is difficult for us to pay for the dialysis. Sometimes we owe them, and anytime we get the money, we pay back. Our being here is being taken care of by our blood relations. We are very poor. My husband cannot afford the 450 Ghana cedis. Without the support of my family, I would have been dead by now.
Ubeide was supposed to be discharged by the hospital a month ago so that she could come into the center for the dialysis. She is however unable because she cannot offset her medical bills. Her medical bills at the hospital is a little over 10,000 Ghana cedis, including the dialysis, which she has defaulted payment of 4,200 Ghana cedis.
Because of the cost involved, so especially this woman, she's supposed to have gone home, I think last 2 months, and be coming for dialysis. But because of cost, they can't even offset the hospital bill at the ward level. So they are forced to be here and be coming for the dialysis till they pay the bill, then they go. So for her like this, it's the cost that is keeping her. If not, she would have been home and be coming for dialysis.
Unemployed middle age, Mariam Yahya is a mother-in-law of Ubeide. She says they are at their wit ends and seem to exhaust all channels to enable them for the medical bills.
We have nowhere to go for money again, and yet our bills are piling up. It is because we are unable to offset our bills. That is why we are still here. Our people have helped us a lot. Can we continue to go to them?
Ubeide appeals to the government to consider adding dialysis to the list of medication on the National Health Insurance Scheme.
Government should take a second look at our plight and include dialysis on NHIS.
Medical Director of the Upper West Regional Hospital, Dr. Robert Amesia, however, wants a conversation of prevention of kidney diseases.
I think prevention is always better than cure. People are selling all manner of concoctions that people consume. Some are very toxic to the kidneys. What about that? So it's emotional to have people who are suffering, that are struggling to get help. But how do we prevent people from getting to that stage? Because if we don't prevent, we thought we didn't have enough patients who would have been requiring dialysis until we started our center. And we realized that even the 3 machines that we have are not adequate. It means that what we're even seeing is a tip of the iceberg. So this issue of affordability, we need to resituate it well. If everything is provided and you are able to do it for free, why not?
For now, patients undergoing dialysis at the hospital can only be grateful to the hospital for having such a facility which their survival hinges on. They are however pressing on the government to, in the future, be able to work through the jigsaw puzzle to make the financing of dialysis treatment free in the country.
Reporting for Joy News, Rafik Salam. Wow.
Now to other stories, and the National Health Insurance Authority has set up a committee to review and assess whether the NHIS can absorb the cost of dialysis. This is according to the one who has been speaking for the NHIA, according to the Director of Corporate Affairs at the NHIA, Oswald Mensah, who's been speaking at a Joy News thought leadership event dubbed Dialysis Crisis. Maxwell Agbagba wraps up the event.
I'm very angry.
What's your story?
I am very angry. I'm more angrier this morning. People are dying each day. The dialysis machine in Kolebu Gospel.
Voice of activist Nasiba Bauer at a protest demanding a reduction in the cost of dialysis treatment after the Kolebu Teaching Hospital increased the cost from 380 cedis to 765 Ghana cedis. The amount has since been reversed. It triggered the Dialysis Crisis series on Joy News, highlighting the plight of 54-year-old Georgina Pia, who couldn't afford the cost of dialysis. 15-year-old Priscilla Sante, who died some hours after she was featured in the series, pleading for assistance with her dialysis treatment. Some patients with kidney failure held a press conference and said 14 of their members have died between May and September after the Kolebu Teaching Hospital limited its dialysis treatment to just emergency cases. The hospital said it had run out of consumables. The renal patients who said they were being sponsored were now compelled to pay for dialysis treatment in other facilities. Speaking during the stakeholders event held in the studios of Joy, Chief Executive Officer of the Kolebu Teaching Hospital, Dr. Pokuwari Ampoma, said the decision was taken because the Kolebu Teaching Hospital renal unit is suffocating under a 4 million Ghana cedis debt. He's unsure when the services will be made available to outpatients. He says the facility will also need 961,000 Ghana cedis monthly to keep the cost of dialysis at 380 Ghana cedis.
We are now engaged with government, with the ministry, with other stakeholders to see how quickly we can, find the resources to advance. Because at the moment we are sitting in a 4 million cedi hole. If we are to operate at our current capacity, which is about 2,000 dialysis sessions every month, then it means that we are going to accumulate about 961,000 cedis of debt every month, in addition to the 4 million cedis that we have already. So this is financially unsustainable.
You can't tell when exactly the OPD will be opened.
Yes, exactly.
You can't tell.
I can't. Yes.
Okay.
So it's 4 million. We have a 4 million deficit.
Okay.
And then if you are to run at full capacity, we will need about 961,000 cedis subsidy every month to be able to maintain the current prices.
Presidential advisor on health, Dr. Anthony Nsiansari, says steps have been taken to settle the debt.
We are waiting for what they are supposed to bring and then to be worked on as quickly as possible. The money is supposed to be provided by our Ministry of Finance, isn't it?
Yes.
Yes. Okay.
So Dr. Mpoma has to put everything that he is doing, that is being asked to do, as quickly as possible in place. If I were him, I would use 24 hours to put everything in place and present it. Yeah, so they'll present it.
You've already presented.
And no, you're free to talk because this is direct.
I've told him what to do.
Yeah.
And then quickly, I'm sure I know what normally such things are very dear to the heart of the authorities, and it will be done.
kidney failure patient, Kojo Bafwahinkra, says most of his colleagues feel they are a burden on society, with friends deliberately not answering their calls.
Now, we are becoming a burden to the society. You pick a phone, you want to call your friend. He knows you are coming to ask for money, so you will not even pick.
Wow.
You pick a phone, maybe you want to even to say hello, maybe there's an information you are trying to ask him. He will not even answer it. Later on, he will call back and say, oh, child, I saw your call, now this somewhere. It's not true.
Now, the push for the construction of an airport to serve both the western and central regions is receiving a further boost with the release of a feasibility report for an airport in either the central or western region or between the two regions. According to engineer Leslie Alex Ayer, senior partner for Ayer and Ayer, the consultant who worked on the feasibility studies, constructing the airport will open up the economy and create jobs for thousands of Ghanaians.
You just look at Ethiopia. Look at the per capita income of Ethiopia as compared to Ghana. And tell me whether that's important or not important. You see, when connectivity increases, the lifestyle of the people would improve. Healthcare, because then you can do, if you have an international healthcare center here, it's easy to get to Ghana. Yes. So there's a direct correlation between improved connectivity and then the standard of living. Because listen, if we were to give people, you see, you share riches, you don't share poverty. People will live a better lifestyle if industry booms. And industry cannot boom. You cannot have the markets if you're just selling to the Ghana market. Things become expensive. You know, numbers just reduces costs of operation. If you have a bigger market, your cost of operation then goes down. Then industry improves, there are more jobs, etc. Because if you are building for 3 million people and suddenly you're building for 16 million people, that's 5 times. It means that your labor, then people have jobs. Unemployment just goes down. Your country looks better. And there's a ripple effect there, direct, indirect. Look, if I build an airport, taxi drivers around make money. Those selling other products, they make money around the airport. Tell me if it were not there. Drivers will be lying in their cars and they'll be sleeping. But this car rental, hotels, you're generating jobs around the area. And tell me if this is not a priority. The priority is to create jobs. And they do something that will generate jobs, that will alleviate poverty. I believe in wealth generation, not poverty alleviation, wealth generation. If you generate wealth, you eradicate poverty. That's it.
President Akufo-Addo says his government will not relent on effort to make teaching in Ghana a comfortable job. Speaking at the Ghana Teachers Prize Awards ceremony, he admitted that despite their best effort, teachers will face considerable challenges.
We come together not only to honor the teachers who have devoted their lives to shaping the minds of past, present, and future generations, but also to recognize the paramount role education plays in the development of our nation. Teachers play crucial parts in preserving and transmitting this heritage to the next generation. They are the torchbearers of our values, our traditions, and our ideals that bind us together as Ghanaians. However, we cannot ignore the challenges that our teachers face in their noble profession. From inadequate resources to limited professional development opportunities, these hurdles can sometimes hinder their ability to provide the quality education our children deserve. It is our collective responsibility to address these issues and create an enabling environment where our teachers can thrive and continue to impact lives. I stand before you today, committed to ensuring that our teachers receive the recognition, support, and resources they need. We will continue to work tirelessly to improve the conditions in which they teach and to provide continuous opportunities for their professional growth.
Now, Africa Education Watch and Action Aid have jointly unveiled a comprehensive report on educational financing with a spotlight on the effect of meager budgetary allocations on the development of school infrastructure. The report says this impedes effective academic work. Executive Director of Africa Education Watch, Kofi Asare, emphasizes the urgent need for government to adopt the report's recommendations.
The Tax Policy and Education Financing Qualitative Report, a collaborative effort by EduWatch and Action Aid Ghana, investigates the repercussions of existing tax reforms on education funding. The findings reveal that Ghana allocates only 13.1% of its national budget to education, falling short of the UNESCO recommended benchmark of 15%. The report underscores that delays in budgetary allocations, coupled with the District Assembly Common Fund failing to meet constitutional requirements, compel local assemblies to rely heavily on internally generated funds. This source often proves inadequate for funding essential school projects. To address these challenges, the report advocates innovative revenue mobilization strategies at the local level and suggests penalties for defaulting taxpayers. According to Executive Director of EduWatch, Kofi Asare, these changes, if implemented, promise to enhance the quality of education, particularly for underprivileged individuals.
Location their socioeconomic status so that they're able to access quality basic education. District assemblies are at the center of the provision of basic education. Per our pre-tertiary education law, it is the mandate of these assemblies to build schools and provide education infrastructure. The challenge has been that over the years we've seen a virtual stagnation in the number of basic schools being built. In many municipalities, we are hardly building even one school in a year. And as the research has pointed out, in Adenta, for instance, in the past 4 years, we've been able to build only 2 primary schools. If you have a municipality where over 90% of basic schools belong to private owners, it limits the ability of the urban poor to have access to basic education, which is free. And so this research and convening is aimed at finding innovative approaches to financing basic education, especially basic education infrastructure, both soft and hard, and I mean decks and buildings in local assemblies.
Karen Obing's report read to you.
Now, still on education, Director General of the Ghana Education Service, Dr. Eric Nkansa, is urging students to take STEM education serious. Speaking during a tour of some educational institutions in the Sekeni Takoradi metropolis as part of activities to mark this year's Teachers' Day, he indicated that there were more opportunities for students who want to pursue STEM education at the tertiary level. There is more in the following report.
Education Service, Dr. Eric Nkansa said he was impressed with the performance of the schools and applauded the Western Regional Director of Education, Felicia Ejebia Okai, for her great innovation and leadership. He advised the students to take STEM education serious, adding that there is a pre-engineering program for interested students.
Yes, the pre-engineering program is a program which has been introduced by the Ministry of Education under the leadership of Honorable Dr. Yaosei Educhum. And it's supposed to do one thing: help our learners who, for one reason or the other, didn't pursue any program in science at the secondary school. So for those who did visual arts, those who did business, those who did home economics, and then even general arts, okay, we'll still give them another window of opportunity to do 1 year, more or less, pre-university program, which will prepare them into a major engineering program at the university. And currently it's being done at University of Mines and Technology, UMAT, and then Pentecost University in Accra. 2 cohorts are already in school now. The feedback we are getting is that the kids who went in there to be groomed for 1 year for fixes, mathematics, engineering, drawing, and other subjects related to STEM are doing very well, because you need to pass that stage. Once you pass, then you can choose any engineering program of your choice. We understand they are doing very well, competing, and in some cases out competing even those who did science. So that is a program that for those who did not even do science here at the secondary school still have the opportunity to take, especially if they have the desire to become engineers.
After his tour at Secondary College, a Hanselman Girls Senior High School, Diabene Senior High School, among others, Dr. Eric Nkansa met the professional learning community of Archbishop Porter's Girls Senior High School to discuss the various ways of teaching challenges, topics, and implementing the curriculum for the second cycle institution.
Today I'm going to observe, not just observe, but take part in the professional learning community. That is a community of teachers where they come together to discuss various ways of teaching, challenging topics, and then also the implementation of the new curriculum that we are putting up for the secondary schools, how to implement, how to teach it, where there are difficulties, how we are able to complement each other. And it's something that has been introduced at a basic level and is doing very well at the secondary school too. This year we have started and we are implementing it across the country. So I have to come and observe how it is going and then participate in the process for them to know that indeed the whole GES is behind this and it's something that we want to stay. And I'm sure once it comes to stay, it is going to help teaching and learning in our schools.
For Joy News, in Athalia Kwanza, Western Region.
Now, in the quiet corridors of the Kwame Nkrumah University of Science and Technology's Brunei complex, there is a battle for the bells and ringers. Contestants of this year's National Science and Maths Quiz have transformed their rooms into arenas of intellectual warfare ahead of the preliminary stage, which starts today. Jacqueline Ansumayabua reports.
Ukwas, what is the SI unit of the following physical quantities and determine whether they are scalar or vector quantities?
A, 3,6.
Contestants have been tirelessly prepping ahead of the National Science and Maths Quiz preliminary contest.
How long could you stay in a day prior to this contest?
Out of the 24 hours, 18.
Their dedication echoes in the midnight oil they burn, their textbooks worn from relentless study, and minds sharpened like the finest blade. They say the early bird indeed catches the worm. The hallways of Brunei complex echo with the sound of bells, ringers, and passionate debate.
The next school: A, 0,2, B, 8,1, and C, 7,3.
Yes, right. 7.5 square meters.
That's correct.
For NIFA SHS, Equipaman SHS, and McGee's, they have converged to understand the significance of preparation.
NIFA luminous intensity.
So it is candela and it is a scalar quantity.
That is also correct.
Their trainer believes that the students are well prepared and the daunting task ahead shouldn't be much of a hurdle to cross.
Yeah, we are very prepared for the contest ahead and we are very confident in them. They can make us proud.
As the preliminary contest begins, these young minds are not just participants, they are beacons of knowledge, illuminating the path to a brighter future. Their commitment reminds us that in the pursuit of excellence, every moment of preparation counts. For Joy News, Jacqueline and Suma Yeboah.
Or it is a scalar quantity.
All right, I'll give it to you.
And that's how we wrap up the AM news here on the Joy News channel. Up next is the news review, but remember there's more news on myjoyonline.com. Good morning.